basically, the vaccines, the mRNA injections have proven a failure in stopping the spread of the transmission. Omicron is basically endemic. It spreads like the measles virus, so everybody will get exposure to it. And the reason countries all around the world are lifting these mandates is because they've come to that realization. The Canadian government, of course, lags the civilized world by weeks and weeks, so we're in the dark ages still. Everybody will get Omicron. Everybody will get proper immunity. Natural immunity produces a different response than the vaccine-induced immunity. And that is a simple message, science-based. The science literature clearly proves natural immunity is vastly more robust than the vaccine-induced immunity, the engineered immunity, so-called. And this is the only way. Omicron has been a blessing, basically. We're very lucky that it's evolved to be more harmless, because if it went the other way, they couldn't vaccinate themselves out of a much worse pandemic. So humanity, once again, very lucky.
What do you think about the notion that we're going to continue to get new variants as long as, the West is not doing things to make sure that the continent of Africa and the rest of the global South gets vaccinated? They've got a vaccination rate of about 10%. We got the Delta variant from India. We got Omicron, possibly from South Africa, and we might get a new variant from somewhere where they've got a lower immunity. What do you think about that?
Well, the whole emphasis on the variants is a little fraudulent. Genetically, they're very similar. I believe I read the literature where they did a test on people who recovered from the 2003 SARS virus, and they found they had the T cell recognition, so immune recognition of the newer SARS-2 virus nearly 20 years later. And SARS-2 is substantially different genetically from SARS-1 from 2003. So people with 2003 immunity were still immune to the virus 20 years later, and about 30% different genetically. So pretty fraudulent discussion, this emphasis on variants. Genetically, they're pretty similar.
Right.
And basically the science of natural immunity is pretty firm. There's 40 years of research. We know about T cells, we know about B cells. The whole emphasis on antibodies, which everybody knows are fleeting, is again a little bit fraudulent, the way it's portrayed. That you need antibodies constantly, you need to get injections every 4 weeks just to maintain a certain level of antibodies. That goes against science. I mean, the T cells are there, they provide immune recognition for decades, probably, maybe a lifetime.
So which politicians in Canada do you think are supporting this cause? O'Toole was just kicked out, arguably because he wasn't against the mandates. And then you've got Bernier. Who do you think is, which politician is these people's voice?
I'm not sure where Bernier stands exactly. I mean, I'm not particularly politically aligned with anybody. I just think that the current government simply does not have the mandate to force medical procedures, experimental medical procedures on the society. So I'm simply against the current government, and I would urge all of the institutions to basically look at the science honestly.
Well, on that note of the current government, are you familiar with the memorandum of understanding in Ottawa that would go to the Senate and the Governor General to end the mandates and dissolve the government? Have you heard of that?
No, I haven't.
Oh, okay. It's a thing they've put forward, the Convoy in Ottawa, and it basically calls on to dissolve the government through a mechanism. It's not entirely clear how, but somehow through the Senate and Governor General would dissolve the government. That's what the supporters of the memorandum say. Yeah. What do you think about that? Would you support something like that?
Well, I would. I don't know if dissolve the government over that, but I know that the current government, with 28-30% of the support from Canadian society, simply does not have the mandate to mandate injections on a wide scale like this. I don't know too much about that avenue for dissolving the government.
Right.
We would need somebody to replace them, obviously, and I don't think there is one currently that would provide any sort of different solution. they'd go to the same bureaucracies, the same institutions, ask the same unelected, advisors and get the same sort of opinions. Now, we need to reshuffle the health bureaucracy, the people that have been informing Trudeau, because, these guys are mostly lawyers. They don't really know much about science. Like Trudeau himself is an undergraduate with a BA undergraduate. What does he possibly know about?
A drama teacher.
Yeah, so he gets informed by the people that form the policy, but those people are behind on the science. So I would say a reshuffling of the institutions responsible for COVID policy would be desirable.
And the mandates are provincial, and that's why folks are here, I imagine. So how do you feel about the Doug Ford government and the way the Doug Ford government has governed throughout the pandemic?
They haven't been very different from the federal government. They basically piggyback on the policies formed further up above. So again, there's this sort of institutional inertia. They just follow along what comes out of the CDC in the U.S. and then the federal government does that, and then the provincial government. So I would prefer more sovereignty, like proper institutions with the power to actually do their own research, come to their own conclusions, instead of just piggybacking on policies formed elsewhere.
And the CDC, I guess, takes some cues from the WHO.
Oh, certainly, yeah.
And how do you feel about the WHO?
Well, I think they've thoroughly discredited themselves. So I don't think they have any say into national policies here in Canada. So.
What do you think about the lab leak theory?
It's the most credible one going right now. They still haven't found the natural animal reservoir for this. I mean, back in 2003, they found the animals were responsible for SARS within a few months. I mean, it was there. It came out of nature. Whereas here we are 2 years later, there's still no natural virus found in the wild. It hasn't been identified anywhere, so it's a credible theory.
So gain of function research,
most likely,
that sort of thing.
Yeah, the U.S. is deeply involved in weaponizing biological agents, and they probably subcontracted that out to the Chinese because I think there's treaties that forbid them from doing that kind of work in the U.S.
Oh, I see.
So they probably subcontracted that work to China. It's very credible, I think.
So if the lab leak theory was true, who would be to blame, the United States or China?
Yeah, both of them. Yeah.
Both of them.
Yeah, in this case, that work was contracted over there, and they were well aware of it.
Yeah, a lot of supporters of lab leak theory don't realize that the United States is in Wuhan, and they blame it all on China.
I think they had hearings in Congress. I think Rand Paul was the one to bring that up.
Right.
And then it disappeared from the public square, that discussion, pretty quickly. So it's the most credible theory right now, I think. Yeah.
Anything you'd like to add?
I think you guys covered it. Some pretty good questions.
What's the best way to get healthy if you get COVID?
Well, it's good to be healthy in advance.
Already, yeah.
So maintain a healthy weight, exercise, obviously, take responsibility for yourself. But there's pretty good treatments now. I don't have to mention the ivermectin, but there's a lot of people that have treated COVID now for 2 years. There's protocols. So it's a pretty mild disease now too. Especially my family just had Omicron, swept through my household. I didn't catch it because I was naturally immune from the previous. I think it was the UK variant back in April 2021.
Alpha.
One of the alpha variants. So natural immunity works. I have a testament to that. I didn't get sick. The rest of the family got Omicron, and most of them just had a headache, so they just walked it off. So I'd say if you get COVID, drink water, stay at home until you feel good. Vitamin D, get some sun, and do cardio later on. A strong heart is the best thing against the virus. It seems the people with the weakest hearts have the worst problems with COVID. Yeah, so watch your weight, do cardio.
Okay, thank you.
Thanks very much.